Our group will discuss about nurse retention rate in North York General Hospital Medical Surgical Unit. Our mission is to increase the retention rate in North York General Hospital Medical Surgical Unit by the end of 2024 by 20 to 25%. Introduction: Retaining skilled registered nurse in Medical Surgical Unit in North York General Hospital has become increasingly challenging during the COVID-19 pandemic. Our study aims to evaluate the effectiveness of the specific retention strategies implemented after the onset of COVID-19 in improving retention rate by 20% within 1 year. Why we choose this topic? We choose this topic to emphasize the struggles among nurses and the future nurses, and also to explain the reason behind the problem of retention of registered nurses. Why it is a Canadian healthcare issue? Many registered nurses have reached their limit and others totally left their profession during COVID-19 pandemic, thus putting the public at risk in not getting the proper nursing care they need. The nurses are the frontliner in giving quality care to the patient, especially during the time of COVID-19 pandemic. However, nurses get tired emotionally and physically, resulting to feeling burnout, morally distressed, and wanting to quit their job. This issue is critical as a high turnover rate can significantly impact patient care quality, nurse burnout, and staff shortage. During the pandemic, the nurses are obliged to work and handle high volume of patients that can cause more mistakes due to insufficient knowledge and lack of training and lack of staff. As a result of staff shortage, the workload of the nurses increased, leading to feeling of exhaustion. On the top of that, understaffing and burnout can risk the patient's safety and result in medical error that affect the patient's health.
For our slide number 6, according to Registered Nurses Association of Ontario, these are the common reasons why nurses leave the workforce. 67.9% of nurses indicated they were burned out. Possible cause can be increase of workload. 5.8% reported exhaustion, and another 12% reported disengagement, maybe due to lack of recognition and poor leadership. The two images shown in slide number 7 show how North York General Hospital have increased the retention rate. The image above says that North York General Hospital have 3,903 total number of staff employed in the year 2021. And on the image below, it can be seen that the total number of employees have increased to 4,101 for the year 2022 to 2023. It indicates that the hospital's retention programs are effective. As I have mentioned, retention programs that used by North York General Hospital includes mentorship, a program that aims to pair new nurses with experienced professionals who provide guidance, support, and share knowledge. Professional development opportunities is also one. This will offer continuous learning for the staffs, includes training such as CPR or IV insertion, leadership courses that the hospital will provide. Another would be competitive compensation. This includes higher salaries, bonuses, and additional health benefits like dental health insurance for the employees. Through these said programs, nurses will feel valued and fairly rewarded for their demanding and stressful work. The barriers to achieve these outcomes could be allocation of funds, meaning hospitals must ensure they have enough budget when planning to raise salaries of the staff. Another would be resistance to change. Though nurse leaders will accordingly plan for trainings, but if the employees will decline, it will not become successful. Regarding mentorship, a mentor must be willing to do the task to properly train the newly hired professionals. Impact of retention programs could be negative. This impact of poor retention of nurses will be dissatisfaction of the staff, patient, and family due to ineffective leadership. it will result to poor quality, safety, and patient outcomes. Positive impact will surely increase retention and satisfaction of not just nurses, but for patients as well.
Plans to ensure sustainability focuses on these strategies. First is improve work environment, addresses issues like workload, stress levels, and workplace culture. Training and development, invest in training and professional development opportunities for nurses. Recognition and appreciation, implement programs that include awards, incentives, and for exceptional performance. Communication and feedback emphasizes open communication channels that allow nurses to express concerns, provide feedback, and feel more engaged in decision-making process. Work-life balance. This includes flexible scheduling and wellness programs. Competitive compensation and benefits, for example, wages, salaries, and bonuses are all considered financial components of compensation, whereas benefits include paid time off, retirement savings plans, health insurance, and other advantages. Career advancement opportunities may involve opportunities for career promotion or enroll in specialized training or leadership roles. We have also applied nursing theories in our study. The Kurt Lewin and Edward Lawrence Chaos Theory. Kurt Lewin talks about the need for a structured approach to implementing organizational changes that can enhance job satisfaction and retention, while Edward Lawrence Chaos Theory suggests that even small improvements in work conditions, support systems, and professional development opportunities can significantly impact nurse retention.
Healthcare organization, particularly North York General Hospital, face challenges with nurse retention. By addressing this problem, we chose two leadership styles that can be useful tools in improving nurse retention rates by the end of 2024, which are the democratic style and the transformational leadership. Democratic leadership style can significantly contribute in improving nurse retention. It is by fostering an environment which the nurse may feel valued, heard, or empowered. There are several ways that we can use to show them how we valued or empowered nurses. Like, for example, um, setting an open communication channel among employees. Second, we can allow nurses to voice their opinion or suggestion, or let our nurses participate or collaborate in the problem solving. And also providing a continuous education, skills development, and career advancement opportunities can enhance nurse job satisfactions, which can be a factor why they will want to retain in the hospital. The second leadership style that we may use or we may combine with the democratic leadership style is the transformational leadership. This type of leadership focuses on inspiring and motivating nurses through vision and personal influences. This type of leadership may inspire nurses to embrace changes which can contribute in achieving our goal, which is to increase nurse retention rate. These two types of leadership, democratic and transformational leadership, can empower nurses. It can also improve communication and foster innovation. And also, it enhances job satisfaction, which can be an important factor in increasing nurse retention rate. For the summary and conclusion, our study focuses on the main problem, which is the nurse retention in North York General Hospital Medical Surgical Department. We also emphasizes why it is considered as one of the Canadian healthcare issues. And by addressing these two, we come up to make a goal or set a goal, which is to increase nurse retention by 20 to 25% by the end of 2024. But in order to achieve this, there are several factors that we need to consider. For example, a list of evidence-based solution, the possible barriers, and then the possible impacts of our solution, We incorporated the nursing theories and leadership style in this goal in order to improve nurse retention. We also make a plan to ensure sustainability of our goal. Our study demonstrated a strategic and evidence-based approach enhancing retention at North York General Hospital Medical Surgical Department. We set a clear goals by acknowledging the problem itself. We outline expected result and emphasize the importance of ongoing commitment and collaboration among nurses.
Thank you for watching. Meet our team. Karen Acosta, Cecilia Belda, Cyril Rose Lima, and Mary Jo Yap.